Good evening. I'll call this Board of Health meeting to order at 6:31 p.m. First up, the Pledge of Allegiance. If everyone can please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Item number 2 is to accept some of the minutes. We have accept the minutes for the September 18th meeting.
Will we add to all of these?
Oh, let's see.
I was there.
I
You
was,
had to table it. How come?
I was not in October.
they weren't completed.
Okay.
Okay.
So everybody know when they were at them?
So I'll make a motion to accept the minutes from September. Roberta and I were both there.
Okay, I have a motion.
Second that.
And a second. Any other discussion? Seeing none, all in favor?
Aye.
Passes unanimously. Accept the minutes of October 16th meeting.
I'll make a motion to accept the minutes from the October 16th meeting.
I second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor?
Aye.
Passes unanimously. Accept the minutes of the October 29th meeting.
I was not there.
I make a motion to accept the minutes of the October 29th meeting.
I'll second that. I have a motion and a second. Any other discussion? Seeing none, all in favor? Aye. Passes with 2 and 1 abstention.
We have a November meeting,
Right.
which the board attended. Roberta, okay, this was our, yep. So I'll make a motion to accept the November 5th meeting.
Sorry, I second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor? Aye. Passes unanimously. Moving on to number 3, Region 2, Emergency Preparedness, nothing to report. Moving on to number 4, Public Health Nurse. So we are in need, at the end of December, we no longer will have a public health nurse. So there are a couple things that we can do. We can contract for services with someone. We can look at the city of Worcester for one option. We can put it out there to see if anyone is interested in being a health nurse.
Did we look from inside our Board of Health for that, to see if that was a possibility, if a board member could serve as the nurse?
No,
We did not, or she cannot?
she cannot.
She cannot.
Okay.
She cannot serve two jobs. She would have to step down from the board. So you have a couple of options. You can put out an RFP, a request for a proposal. Or the other is we could pick up the phone and contact the city of Worcester and see what it would take and what would it cost to provide those services. And
So it's
Well-
anybody's,
And currently, we just pay per occurrence.
pardon?
We just pay for need.
right.
And-
Right now, right, we're on a pay-as-you-go. We were on a pay-as-you-go. And we could probably do the same thing with, we did try the town of Sutton
Right.
to see if they would be willing to go into a joint venture, and they're too far out. They've got 10 towns that are in there. That was only a personal search. So now we haven't done an official publication search, so I think it's probably time.
I think we better.
We could start off with probably sending out to like the local nurses association, or just advertise in the newspaper that the Dudley Board of Health is looking for a public health nurse.
What's
a
the job
part-time
description?
basis, hours to be discussed, et cetera, et cetera.
Okay.
That's just like an independent contractor position.
They would become an independent contractor, yep. Who knows, maybe one of the other, like a visiting nurse association or somebody would like to step up and do it, or run an attempt at it.
Mhm.
I don't know, is Samaritan Nurses still around?
I'm not sure.
The ones from Webster?
I know there's the B and A.
Yeah, V&A
The
Sutton
V&A?
County.
V&A.
and Worcester County, so they're different entities, but. What's the job description? You show me. I'm
Well, the
curious.
job description would be to oversee any vaccinations that are gonna be needed, disease, to receive a notification of diseases, to do disease follow-ups. If we get reports of communicable diseases where the nurse has to do a follow-up with the patient. There may be some needs also to have, like for TB, where they may have a supervised medication dosing, where they have to go every day. For foodborne illness infections and all of that stuff, for GI infections and all of that stuff, they may have, the nurses may have to go and then do follow-ups and, or reports of, let's see, what else? They,
And
a
it
whole
would,
plethora of,
Mhm.
and you have to deal with the MAVEN reporting system. MAVEN is the state agency where all of these, there are certain diseases that have to be reported to the state.
Right.
And then it gets reported back down to us where we may have to do follow-ups and all.
so would you like me to speak with Greg tomorrow?
Yeah, find out, it's either that or we can just pick up the phone and I think that one of the things we ought to do is at least investigate the Worcester Consortium for public health. They provide all kinds of services. They do everything from housing inspections to restaurant food, Title V, and they provide nursing services as well. You can do an à la carte thing, an à la carte program with them. I'm not sure what the fees are, and I couldn't even guess at it. But they could tell you, based on what we have, it's not that expensive to do the nurses, that's for sure. Our nursing program wasn't that expensive.
No.
I think there's a few avenues that we probably could explore a little bit more, getting a little bit more with the public health nurse, contacting the school nurses, staying in contact with the school nurses, as well as the Nichols has their own health
Nurse.
program as well. And it'd be great to have the 2 or 3 groups all communicating with each other. Because if something happens, then it's,
Right.
What do you think, guys?
Sounds fine. It does sound interesting, but can't do both. So,
I understand. You gotta pick and choose.
mm,
But we're on the search.
Okay. Yeah, I'll see what I can find out over the
The
next.
best source is just to go to Worcester.
well, I think you can do both at the same time anyhow. Throw out an ad in the newspaper and throw some feelers out there. See if anybody's interested in becoming a public health nurse.
Okay.
Job description and salaries to be discussed at a later date.
Is that something one of the school nurses could do or something like that, or is that conflict, or?
I don't know.
I'm so sorry. It's not.
I don't know.
I apologize.
I'm sure that if they're on a school clock, they,
Can't be anywhere else.
Right.
Yeah, not during the day.
but they may very well be able to. Maybe we could talk to the superintendent of schools and see if they'll, if
Well,
this.
nobody's gonna do that, a public health nurse for one town and do nothing else and be on call 24/7.
Oh, we had it in Webster. We had, one public health nurse, and, she was actually one of the school nurses.
Yeah.
But the private school, it was a parochial school.
All right, we'll put it out there and see what we can come up with. Okay?
Good.
Okay. Item number 5, marijuana regulations. So I know we've gone over some different regulations, reviewed a lot of different things, and hopefully coming together with something.
And we've looked at the, the medical standards for Worcester, the adult, standard policy for Worcester, and,
They have also, there's, in that packet, Ted, there's the final draft. The Worcester, City of Worcester's final draft.
this is not the final draft, or there's a?
Yeah.
There's
This
one,
is it, right?
one of the items in there, one part of that packet is the final draft for the City of Worcester.
Where would I see that?
And,
I think it's this one, isn't it? This was the,
But this is just for adult use?
this is for adult use. And then we had the medical one last time.
Mm-hmm.
That was this pack, remember this whole thing,
Number 1, right?
right, with the application and the license
All the
and
paperwork, right?
Yep,
Mm-hmm.
all of that. And the signatures,
Right.
because we were gonna do that for medical and adult.
Right.
And then, the only other thing was is
That letter.
establishing a fee. Oops.
The fee of $500, a license fee.
Yep.
Is that a yearly fee?
Yes.
Okay. And without reinventing the wheel and having the state of Massachusetts have their own regulations before it gets to the local level, and then the local level has regulations, and without reinventing everything, we could just adopt the same,
a similar, I would suggest a parallel packet to the City of Worcester.
parallel package.
The reason is the city solicitor and everybody's been poring over it to make sure that they did everything the right way. They're meeting all the requirements. At least you can use it as a boilerplate and,
I agree.
and amend it accordingly, and still be safe.
Okay, so I will, entertain a motion that we,
Have a parallel.
right.
Prepare. You want to
We
prepare
prepare a
a
parallel
parallel document.
document to the Worcester.
Right, for, medical and adult, with a $500 licensing fee, and using all of the same paperwork, everything, forms.
There's 3 packets we went through in
Yes.
this.
Right.
That's correct. So I'll entertain a motion.
It's a lot.
Do we have to say what they're called? No, because we'll do it all. We're just gonna do parallel through the city of Worcester.
All right, so I can say I entertain a motion to write up.
Prepare.
So
Prepare.
prepare a
Parallel
parallel
document
document. I lost the rest of my wording.
to the city of Worcester's regulations for
To the city of Worcester's regulations for
both marijuana,
adult
both
and,
medical marijuana and adult use marijuana.
what he just said.
Did
Yeah.
you get that, Teresa?
I'm getting there.
After you get that, can you just read it back to us?
That was way too much. Adult use. Alright.
Yeah, they don't use the
And
term
forms.
recreational anymore.
And forms.
Yes.
Forms.
With $500 licensing fee.
With a $500 license, yearly?
Yearly.
Yearly licensing fee. Yeah, we have to make that clear.
Okay, so I have that Ted made a motion to prepare a parallel. Oh, no,
made the
Roberta,
motion.
I'm sorry, you started and then.
I started,
with
but
that.
then she just,
Because you always do.
yeah, that was nice of you.
Thank you.
So Roberta made a motion to prepare a parallel document for medical and adult use marijuana, a parallel document to the Worcester regulations and applications for medical and adult use marijuana with a $500 yearly licensing fee.
Sounds good.
I have a motion.
The second.
I have a motion and a second. Any other discussion regarding it?
No.
All right, seeing none. All in favor?
Aye.
Passes unanimously. And what I will do for the next meeting is I will have it all typed up pretty and everything. Okay?
And then we can always go back and modify anything as needed in
Yes.
the future, so we're not stuck to anything.
Right, but at least this way
But
we have something.
We have some.
I agree. Okay. Item number 6, the 2019 meeting schedule. So, just lost it. We have all of our meetings coming for the next year. So if we look through, we have the third Tuesday of every month. Third Tuesday, yes. With the exception of February. Where am I going? April and November. Nope, November's okay this year. With the exception of February and April, where they are listed as the fourth Tuesday because of vacation.
Is that the vacation?
So we've already accounted for school vacation.
Yes. You have a if you, underneath it has the pretty calendar.
Okay.
So, do those dates look good at this point? I know things come up. We are usually very accommodating.
I think so.
Sure.
Okay.
I can't,
So my question, just as a thought, going forward, are we happy with the 6:30 start time? Did we want to start earlier? Is it more convenient? What works? Is 6:30 still working good?
Yeah, right now,
I
that's
think
fine.
6:30 is a
Okay.
good time.
Not a problem. So I'll entertain a motion to accept our meeting schedule for the 2019 year.
Make a motion to accept the meeting schedule for 2019.
That's all he has to say. I second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor?
Aye.
Passes unanimously. Item number 7, Health Inspector's Report.
Okay. Just as an update, there's been some significant changes to the federal food, or to the state food code. The previous code, the FDA Food Code 1999, is no longer an acceptable document to be using. The current regulation, or the current code now is 2013 edition of the FDA Food Code. I would first of all recommend that the board consider getting at least one, maybe one copy for each member of the board, and one office copy. It's about a 400 or 500 page document, but
700 and, I
Pardon?
think it's 718 pages. This-
780, yeah, you don't want to be trying to print it out. It's,
No.
An electronic copy is adequate.
that's number one. Number two is there have been significant, some significant changes in the food code. There are certain establishments now that don't have to be inspected after we worked on that list and hammered it all out. Retail stores that don't have refrigerator items or perishables do not need a food permit anymore.
Do we have any of those?
Yes. We have a couple that would qualify for that. Although one or two of them might have to modify their approach to doing business. Package stores, for one. Package stores, if they don't sell milk and they don't sell juice that needs to be refrigerated, if it's all off-the-shelf stuff, prepackaged, properly labeled, no refrigeration required, they don't need a food service permit. So that would as long as we have, 3 package stores? 3 package stores that would not need food service permits, or retail food, or any type of a permit, other than their own alcohol license.
What if they sell a lime or a lemon on their counter?
It's, I think those are exempt. Again, they're not required to have refrigeration. But if they sell, like I said, milk or juice that, beer is only for comfort. It's not mandatory that beer is refrigerated. So it boils down to, certain establishments, we don't even have to inspect them anymore. Example, the potato chips and apple juice or grapefruit juice that's on the shelf, the ocean spray juice doesn't require refrigeration at all. They don't need a food service permit. So anybody that's selling milk or ice cream or any component thereof that requires refrigeration, now that opens the door for them. The other convenience stores items would be, well, my guess is General Dollar might not need it if they don't have milk and juice. They do sell some refrigerated groceries, so they now required to have it. Other one would be Family Dollar, I think. There's another one up there that they have frozen foods and refrigerator items, so they have to have a food service permit. And there have been some significant changes. The 140 or 141 degrees is now down to 135 degrees for hot holding. And there's a lot of minor changes, but there's an attention for body fluids cleanup procedures, that they now have to have cleanup kits in a lot of the food service establishments for cleaning personal protective equipment, gloves, face and eye shields, disposable shoe covers, all of that stuff they have to have regular for cleaning up vomitus or feces or paper towels, kitty litter, all of that. There's a regular checklist of items now
Is that a new standard for
It's a new standard.
cleaning bathrooms?
I'm not sure about cleaning bathrooms.
Fun times.
And they're supposed to be, they're supposed to have employees that are trained in cleanup procedures now. And gotta go to nursing school for that, I guess. So, okay.
You could get
But,
another.
Could be the toilet girl.
that there are substantial items. I'm going to have some help this year with doing food inspections. Julia's going to come out and give me another hand so we can knock them out very quickly. A couple of items that we have, one is the mill down below here. We're working on a plan to see if we can isolate it and stop the dumping that's going on at the site. I've already spoken to the fire chief today. We're going to be dealing with the building inspector on it as well, and the highway department, so that we can limit access to the unseen areas that are being dumped on. We did get one more complaint about Wysocki Drive. I did follow up with an inspection and found no issues.
Was it the water heaters? Was that in that complaint, that one?
That was the last one, right?
Yeah.
And they were dry.
Those are private property, though. How do you,
How did I what?
I don't even know how you would handle that, that it's because it's private property, then if they were leaking, they'd be broken, and they wouldn't have hot water anymore.
Right.
I mean,
Again, I did the follow-up inspection. We did notify the complainant that we did a follow-up, and we did an inspection on it. I don't think there's much of anything else, was there, Teresa?
When will your season be stopping for install? Do you have any idea yet?
We're pretty close to,
That's right.
I think we're gonna be pretty close. It depends on how, if we get another hard frost. Part of the problem now is the materials are on, let's put it this way, on allocation from the gravel pits. Gravel pits don't have, a lot of them have shut their water supply off, they don't have washing. All they have is what's stockpiled on the site, and once it starts to freeze up, hard freeze, then you can't do a lot of the work anyhow. We're not supposed to be working with frozen material for the installation of septic systems. What we do in a lot of the other communities, in the ones that Jim Malley handles, they shut them all down. It's anywhere between December 1st and December 15th, and in general, they don't open till April 1st.
Right.
So that takes care of the installation. So the only thing there is left is plan submissions, maybe perk tests and stuff like that. But once the snow gets here, then it's very difficult to do surveying as well. It's pretty tedious, and it's funny they say to watch me out there in a 2-foot snowstorm with my 18-inch legs, so.
Okay.
And that's about all I have.
All right. Thank you very much. Anybody have anything for Tom?
Nope.
Okay. Moving on, number 8, clerk's report. Well, we're gonna let Teresa handle it since it's, her last.
Thanks. Other than what you already have in here, this is my last meeting. I want to thank you all, and I wish you well through 2019. I'm sure I'll see you all in my travels since I am a resident as well. And that's it. Just thank you. Thank you all.
Thank you very much. And just so everybody knows, Teresa's last day will be December 27th. hopefully her position will be being advertised this week. It's gonna be advertised internally and externally, both at the same time, to try to expedite things, so.
And as I said it before, I'm available to help with the transition in any way I can.
Thank you.
You're welcome.
Okay. Number 9, old business. Anyone have any old business? No? Okay.
Can't say I do.
Number 10, anyone have any new business they'd like to bring up? I have one note of a town event that's happening. This Thursday at 6 p.m. will be the annual tree lighting here at the Dudley Town Hall, and the town hall will be closing at 4 p.m. this Thursday. There'll be no late office hours, so that we may have all the little cherubs here getting to see Santa. So, that's,
Has
oh,
that fire pit been used yet?
yes, it was used for the Halloween party,
Nice.
which, the Halloween party, we had over 200 kids come through. It was incredible. It was an excellent turnout. It went very well. Gonna tweak a few things for next year. Definitely need more help, as always. But the kids had a lot of fun, and it was a fun night. So, before we finish up, the next thing I have is that our next meeting, we do not have one scheduled in December. If anything were to arise, we would hold an emergency meeting. The next scheduled meeting will be Tuesday, January 15th at 6:30 p.m. So, anything else? Seeing none, I'll entertain a motion.
I'll make a motion to adjourn.
I second that.
I have a motion to adjourn and a second. Any discussion? Seeing none, all in favor?
Aye.
Aye.
Aye. Passes unanimously. Meeting closed at 7:03 p.m.